my name is Jamie Gillespie. I work alongside nursing leadership to address clinical issues to improve patient outcomes using evidence-based practice. Today, I'm going to address medication errors in the hospital setting. In today's presentation, I will identify the clinical issue, I will discuss the PDSA, or Plan, Do, Study, Act change model for this issue, and explain why it is the best model to address this specific issue. And I will also propose an evidence-based plan for implementing change using this particular model. First, we will determine the clinical issue. And today's issue is the prevalence of patient injury due to medication administration errors in the acute care or hospital setting. The FDA defines a medication error as a preventable event that may cause or lead to inappropriate medication use or patient harm. And they receive more than 100,000 reports every year. And those are just incidents that are reported. There's also the issue of underreporting as well. Not only do patients suffer because of these errors, but the healthcare workers suffer as well. Severe psychological effects such as anger, guilt, humiliation, feelings of inadequacy, and also suicidal ideation after harming a patient. The biggest reasons that these errors go unreported or undocumented are threat of legal action and fear of punishment. The most common medication errors that we see in the hospital setting include administering the drug to the wrong patient, administering the wrong drug to a patient, the wrong dose, wrong timing, wrong concentration, or completely omitting the medication. And injuries include birth defects, disability, hospitalization, and death. PDSA, or Plan, Do, Study, Act, is the change model that we have chosen for this issue. Plan, Do, Study, Act is a very simple but powerful tool for quality improvement in healthcare. It's very structured and makes a systematic process for quality improvement. The first step in the PDSA model is to plan. We identify the issue for improvement, develop strategies to improve results, and predict what will happen with these results. The second step is do. We test this practice change, usually starting off with a small scale, and monitor progress. The third step is study. We reflect on the results, we examine what has changed, who and what was affected, and are these results worth keeping? The fourth and final step is to act. We respond, spread, remove, or improve the changes. And we also continuously repeat for quality improvement. Our nursing team felt that the PDSA model was the best change model to address the issue of medication errors because it is very simple, organized, and has minimal steps. It's very straightforward, and it's continuous. It's a cyclical process, and it's continuously repeated. PDSA was modeled after the scientific method: hypothesis, experiment, and evaluation. This process is also very similar to the nursing process. The PDSA cycle also uses the term we and emphasizes teamwork. So in implementing the PDSA model, the first step, of course, is to plan. We are going to start by gathering medication administration error data for each department in our hospital. We will build a culture of safety, focusing on systematic improvements and avoiding blame. The literature does show us that things to improve medication errors are to minimize distractions, improving communication, being able to question and clarify any uncertainty to avoid confusion. With Do, we will start by implementing these changes in one department only. We will also eliminate any handwritten orders, computer entry only. We will provide workshops and continuing education for all our nurses. We will also make sure to educate and empower patients and families, as they also play a big part in medication errors. And implementing bedside nursing report will also encourage the patient and the family to be involved in their care. At the end of the quarter, we will evaluate our data. We will determine how the patients were affected, how the nurses were affected, if these results were positive or negative, and if they're worth keeping. Lastly, if it's determined that these results are worth keeping, we will spread the practice change to the other hospital departments. In conclusion, the PDSA model is a simple and systematic approach for quality improvement. Plan, Do, Study, Act is cyclical, and it repeats itself continuously to improve outcomes. We are using the PDSA model to implement practice changes in an attempt to decrease medication administration errors on our units, expecting that these medication administration errors will decrease in incidence and severity. Once we have fully implemented our changes, we will repeat the cycle and continuously evolve and change our plan as appropriate for best patient outcomes. I truly appreciate everybody watching today and being excited for positive change for our patients.